Hi, this is Zoe from Carepatron. Before you watch this video, don't forget to like and subscribe for more content like this. Neuro checks in nursing are crucial for determining a patient's neurological status. They primarily assess the function of the nervous system, which includes the brain, spinal cord, and network of nerves throughout the body. The neuro checks process is meticulous and comprehensive. It commences with the evaluation of the patient's level of consciousness. This involves checking whether the patient is alert, responsive to verbal stimuli, responsive to pain, or unresponsive. Following this, the nurses assess the patient's pupil response, which includes examining the size, shape, symmetry, and reactivity to light. Motor function, another crucial aspect of neurochecks, involves testing the strength and equality of the patient's limbs, observing for any involuntary movements, and assessing the patient's ability to perform specific tasks. Sensory function assessment checks for the patient's perception of sensation like touch, pain, temperature, vibration, or position changes. Lastly, vital signs such as blood pressure, pulse rate, respiratory rate, and temperature are monitored since they can provide valuable insights into the patient's neurological health. These checks might be performed routinely or more frequently, depending on the severity of the patient's condition. To use our Neuro Checks Nursing assessment, follow these steps. Download our Neuro Checks Nursing assessment from the Carepatron platform, which you can find in the link in the description. Before starting the Neuro Checks, ensure you have all the necessary equipment ready. This may include a flashlight for pupil assessment, a sharp object for sensory testing, and a blood pressure cuff for vital signs measurement. Ensure the patient is comfortable and explain what you will do during the assessment. Assess the patient's level of consciousness by checking their response to stimuli. This can be done using the AVPU method or the Glasgow Coma Scale. Using a flashlight, check the patient's pupil for size, shape, symmetry, and reactivity to light. Any changes could indicate neurological issues. Test the patient's motor function by asking them to perform certain tasks, such as squeezing the hand or moving their limbs. Evaluate the patient's sensory function by testing their ability to feel sensations like touch, pain, temperature, and more. Monitor the patient's vital signs, including heart rate, blood pressure, respiratory rate, and temperature. Changes in these signs can provide insights into the patient's neurological health. Document your findings on a NeuroChecks template or chart. This allows for comparison over time and helps identify changes in the patient's neurological status. Here is a sample of our NeuroChecks Nursing assessment, which you can find on our Carepatron platform. To find our NeuroChecks Nursing assessment, go to our Carepatron platform or click on the link in the description. In our template section, we have a variety of templates and worksheets for you to use with your patients. You can filter or type in the keywords to find the worksheet. Thank you for watching our video at Carepatron. If you enjoyed this video, give us a like. If you would like to see more videos like these, subscribe to our Carepatron channel or click on one of our recommended videos.